Now, before I begin, I would like to take just a few minutes to give you my observations as the board chair about what has been going on internally at Opportunity and how we have been preparing and how we have been responding to employees and our clients. First, as you all know, in a time of crisis like this, leadership is absolutely critical. And I can assure all of you that our CEO, Atul, is no stranger to crisis management. His skills as a banker is coming through. While I'm sure many of us would wish that we could just have the warm and fuzzy Atul every day, now we have the crisis manager Atul who we need. We are indeed lucky, glad, and grateful that he is heading this ship during these very difficult waters. Now, we also know that Atul can't do it by himself. And he has a talented senior management team and all the employees at Opportunity. First and foremost is the safety of our employees, as well as the health and welfare of our clients. You will hear about that today. So before we begin, I also have to do a shout out to employees on the phone. I am so proud of all of you. Seeing how all of you have risen to this crisis, have risen to this occasion. And I have also seen your dedication to our mission. And from me and from all the other board members, I want to say this to you. We are proud, and we know that neither you nor anyone will stop the work that we need to do to serve our clients. So thank you, thank you. So with that, let's get started. Atul.
So I'll just, I won't explain the values that we have, you know those, but what has guided my own thinking, and I know our staff has gathered, is what we do, our commitment is to the poor, and it stays completely. We are committed to the poor. We are called to serve with a spirit of humility. And in fact, if there's one thing that this pandemic is teaching us is to cultivate that spirit of humility. We no longer fully understand the world we are around, living in, or how much we can control when we can. In that, how do we work with respect and with grace for each other? Right? The age-old values, but they bear repeating. In all this, I want to assure you, absolutely any reservations at all, caveats, is that we are committed to doing what we do with the highest integrity. I feel, in that respect, I feel proud of this organization. You know, what we have done, and I could tell you a lot of stories just even the last week of that showing up. We are called to, when we define stewardship as a value, we actually defined it with three particular sub-values. All three turned out to be irrelevant today for the pandemic: accountability, innovation, and urgency. So the creativity of the team has been extraordinary. I mean, completely extraordinary how the teams creatively adapted both to the challenges and the opportunities. We'll hear about it. Urgency, we reacted, and we are doing things with accountability, where we are to our donors, to our stakeholders, to our clients, our partners. So Leanne, I'll close with that. I know we'll go into this and we'll take questions later on. So
wonderful. Thank you, Atul. Tanay, where are you, my friend? I need to see you.
Right.
There you are. It is so good to see your face again.
Right. Well,
so what I would like to do tonight with you, let's take it in two steps. First, let's talk at the continent level. What is going on with coronavirus in Africa? And then let's drill down more into our clients and where we are. And that may seem like, the first part of this question may seem like a stupid question to you, but I have to tell you, we are focused in the States internally, and we are not getting much information about what's going on in Africa, and especially in sub-Saharan Africa. And so we would love to hear from you what is going on in terms of the response to the pandemic, and government's response, and also people's response.
Thank you very much, Leanne, and good evening to everyone. I think 2 weeks ago, I was watching CNN and I saw a map which showed the prevalence of the virus across the world. And most of the parts in the Western world, in China and other parts were red, but Africa was predominantly green. That has changed drastically in the last few days. So even for us as Africans, we were saying, are we kind of sheltered? Questions that we were asking was, is it that we've been ravaged by cholera in the past and Ebola and other diseases that some level of immunity we're not too sure? So the question that we now ask is, are the African governments being truthful about the numbers that they report is also another question, because there seems to be some, political expediency in doing that. So as of now, we know that there are over 2,000 cases in 43 countries. And I have put down some of the countries, particularly those that we have an interest in. Nigeria, for instance, there are 3 and 1 dead, 2 have recovered. These numbers are changing by the minute, obviously. Kenya, 28, no one has died yet. In Ethiopia, 12. Uganda, 14, no deaths. Rwanda, 40, no one dead. In Ghana, there are 65 reported cases and 3 people have died. In the DRC, 46 and 2 have died. In Zim, where I am originally from, 2 reported cases, including 1 young man who recently traveled from the US and was a popular broadcaster. He just died yesterday. He died and was buried yesterday. In Zambia, 12, but no death yet. South Africa also has a significant number. It's 697 reported, but 12 have recovered. So the information that we have, so we ask, are they testing properly? Do they have the resources? Certainly in a number of countries, they have the resources. So it's World Health Organization and other philanthropic organizations starting to come in to help in the testing exercise. Now, initially, I think because of that, because of the green status that I talked about, the governments didn't seem as prepared. So it was kind of business as usual. But lately, things have changed. And a number of countries have closed their borders, stopped all flights to and from various countries on the continent. Still hear me? Coming to our own program, in the various countries where we operate, we've got various measures that we've implemented. All our outlets, our branches, our offices, we have put sanitizers on the outside of our offices so that people sanitize themselves as they go in. We clean surfaces and make sure dry surfaces as much as possible. We're doing a lot of client education to client and staff education to inform them of this disease and what is of hygiene are. We are also in liaison with our regulators, the central banks, to make sure that we get the necessary backing in this. And with the countries that have banking, in particular Ghana, DRC, one of the challenges is around liquidity. To say experience many runs. So far, it has not been like that. It has also given us an opportunity to promote digital channels, and less people are coming to the branches. So we've also downscaled and allowed a few people to take leave. And perhaps let me stop here and then we can expand. plus, Leanne, I think we might even have a short video from one of our operations in Ghana that you may want to show, just to kind of illustrate. But that's up to you. Let me pause at this stage.
So Tanae, let me ask you. In the U.S., we are on information overload. What is the communication like in Uganda, in Ghana, and some of the other countries where it is so imperative to get information, accurate information, out to people?
The good thing is lately, the leaders of those countries, the presidents have started making announcements and, declarations in terms of lockdowns and things like that. And the ministries of health in those countries are communicating. So you've got a lot of broadcasts over radio. And I think lately, all African countries are really trying to disseminate this information and provide information. Just where we're not 100% sure is on the numbers, on the statistics, because the ability to test is very limited.
So, Tanae, the instructions about social distancing, that may work for many of us here, but right outside of your bank in Uganda is a huge market. Practically, how do you enforce distancing? It doesn't make any sense to me. Can you talk to us about that?
That's a really difficult thing for us as Africans, because we really are by and large people.
Yeah.
We thrive in villages and places like that, and generally our markets are crowded. Most of the places that we go to are crowded. So it is a real challenge. How it is being addressed is with the presidential announcements. There is now restrictions on travel, including transport, so limiting that as much as possible. In some countries, being policed a lot more than others. And also, because of the downturn in business, there's not as much activity bringing together. So some of the things are kind of not really intentional. They are consequential, but it will certainly help.
Have you seen a cultural change when it comes to personal hygiene?
Absolutely. And I talk about a silver lining. Every cloud has a silver lining, and the silver lining that I personally see is just the increase in personal hygiene and in the social distancing, because traditionally all across the continent, when we meet someone, we're very quick to shake hands and hug and do that, but that has changed a lot. We tend to now kind of use the elbow and respect distances. People are washing their hands and sanitizing as much as possible. I'm one of thrilled because where we've relocated our office at the market in Kampala, vendors there that sell street food, which is great to taste, but sometimes the hygiene has not been that great. So as part of our corporate social responsibility a while back, we donated water tanks and soap, and we even financed a public toilet there so that we can improve the sanitation and hygiene. It was a difficult sell, but now because of the crisis, things have just improved. What I'm hoping is after the crisis, people will now get used to the new norm and be more hygienic, and that will make a big difference to the continent.
Hey, Atul, can we switch back over to you? And let's turn to you. What's going on in India?
Well, first of all, I have to teach Tanae my Indian greeting, which will make sure that there's 100% hand sanitization. So Tanae, namaskar. So in India, as you all probably have already read, the lockdown as of midnight yesterday. Our time. So we and that's 1.4 billion people. who now have to stay home for 3 weeks. There's a defined time. And the only services that are permitted are offices that are open are government offices, banks to a limited degree, grocery stores, pharmacies, and hospital services. Everything else is closed. So we are, at least in speaking with our staff on the ground this morning, my time, all microfinance activities is currently seized. And I think we'll learn more, Leanne, over the next 48 hours, what the government's response is going to be, how they will support the economic impact of if this 3-week slowdown. The good news in India is that both the central bank and the government are very, very active in terms of making sure that the impact on the poor is managed. But the communities that we work with there are some of the most distressed communities. Right. I know some of the so people on the call, some of you accompanied me to Chhattisgarh, extreme northeast of India. Those communities, vulnerable, marginalized people on the planet. And if you were on those buses with us last year, it's unfathomable how those people will live day to day in this context. So it's a I'm not going to mince my words. This is a unprecedented, if you will, shock. But I have to say that the team's they've been on it in terms of working with our partners, and I know we are aggressively now working with the government as well on how we.
How about Latin America, Atul?
My in-laws are, frankly, I just spoke with my own mother-in-law this morning just to bring it home. 95 and 89, living in Delhi, and she said, "Well, I think we have enough food at home for about 5 days." So as far as she was more concerned about me.
I'm not surprised. Yeah.
So so I passed it on. Yeah, but I told her about
wonderful.
Her blessings to all of you.
Good. So how about Latin America?
So let me turn, I think, Leanne, I'll take a moment to give you a sense from opportunity, my perspective, what's happening worldwide, and I'll give you a bit on Latin America. The one is about our microfinance operations, right, our banking services. In summary, the banking services are critical banking services every work, and the governments are committed to making sure that banks are open to the public. So in Serbia, as an example, even in Uganda now, we are limiting only 2 clients at a time in the branches, right? So that we keep social distance so open. The good news is that over the last 2 years, literally over the last 2 years, I think, or 30 months, 5.5 million of our 10 million clients will access. So, the investments that you all made possible, the work is now paying off. Literally, it is paying off as we speak. In Africa alone, in the last month, through texting, 200,000 transactions were done across our network. So this is to frankly acknowledge our debt to our donors and to our staff, what they've done. So that's on the banking side. This will impact loan repayments, and I know we'll probably talk about that more in our Q&A, but education is the other area. 156 countries as of this morning had shut schools. 1.6 billion children are at home today. They should be in school. 83.5% population is no longer studying. So that's the human impact of this is, one, on daily livelihoods of the people we serve. 2 is frankly, on all of the children, ours and everybody else's. So direct impact of that on our program, critical for us. You'll recall we have approximately 4 million children in the schools. Pretty much across the board, all those schools are shut. We are now starting to work with the school, how they're going to handle that. We have had to close our education quality program. But in the middle of all this, Andrew and his team, and I know we'll talk in more detail with him at next webinar. Have repurposed the team almost within 48 hours to start to, how do we take these schools online? Here kids are going online, there they don't have that capacity capability. So we are right in the middle of, all right, how do providers move education online? What can we do? So that the teams, as we speak, literally working on that to switch over to an online. Partners in about 20 plus countries on how do we help them to manage their portfolios and the impact on school teachers and salaries and things like that. So it's real time. That'll be the big impact. Ag finance is not so much currently. We expect a slowdown on loans, but farms will produce. Our role today, the farmers can get their produce to the marketplace, and that the marketplace is functioning and open. Staff, our own staff, that's what they're focused on, is how do we make sure that the farm produce is getting to the marketplace and they're getting fair price right now. So I'll pause there. Latin America is more limited currently, to answer your question specifically, though it's catching up very fast. Colombia is the one that's most impacted right now with both lockdowns.
Atul, the solution to get kids online, is that really a practical solution available to us?
Not really, but where we can, we should. How many of these children can we really get? I doubt very much that'll be even a very significant number. Forget about majority, because everything is limited. But remember, a large part of the world's population has mobile phones today, right? So so we our active education, how do we connect these families, the kids, is really dependent more on the mobile networks, which we are actually working both with the mobile providers as well as with the school officials. So it's I hope even in a week's time I'll be able to give you more information, but I was pretty, the team's done solid work in switching over very rapidly. In process.
We to Q&A, and here's how we're going to do it. I understand. If you look at the bottom where it says participants, if you click on participants at the bottom of your screen, I'm going to try that, right? Should be an option to raise your hand. Oh, I see. Yeah, there should be an option to raise your hand. So have a question, raise your hand virtually, and then am I turning it over to Allison? Allison, are you there? Do you have control over unmuting the folks who have questions?
Hi, everyone. This is Opportunity Hub. I will unmute you as we are able to go through questions, so we are able to take our turns in getting all the information we need. Thank you so much.
Wonderful. Do you have anybody? Has anyone? Allison?
I don't see any hands raised right now, so I think we're good.
Okay.
To keep moving.
Okay, wait, I see Mike. Okay.
Oh, well, Mike raised his hand after I already said something. So, Mike, I think you just unmuted yourself. Go ahead.
Well, I'll start the conversation then. Can you tell us whether we have had any incidents of the virus, the OI staff, and what the situation is there?
Yeah, short answer, yes, we've had. The person concerned is fully recovered. Was in self-isolation at home with mild symptoms. His close staff also were in self-isolation for 2 weeks, and they have recovered. Sadly, I have to say one of our partner executives in the Philippines passed away yesterday. Our thoughts and prayers are with the family and with the team there. That news just came to me just just before this webinar started.
Well, very sorry to hear that.
Yeah.
Mhm. Allison, are you going to call on folks, or do you want me to do it?
I can go ahead and do it. I see that we have Joel. Joel, if you
Yeah.
are on iPad 4G, I'm going to unmute you now and go ahead with your question.
Okay, yeah, this is Joel Johnson. In Africa, on several trips and in our meetings, it's been impressed upon us just how the overall population is. That the demographics of African countries are very, very different from ours. And recognizing that the mortality rate is close to non-existent in the younger population, are what Tanae described as actions, same kind of actions that we see in the United States, for instance. Is there an opportunity here to change the equation of physical, economic health by isolating and caring for the elderly, but not shutting down the economy and the education system so completely? It feels like that thing to do in the United States, but maybe the trade-offs are very different in full African countries.
Who wants to take that?
I think that's a great observation. Our hope in Africa is that this lockdown is not going to be for long. In Uganda, for instance, the Ministry of Health has said until the 23rd of April. So we're hoping that, and it is true that the young people don't seem to be as affected, even in Africa. So, and the young people are also economically active. So if the lockdown happens now to show the urgency of the matter, and then the governments allow trade to carry on, I think it will be a good thing. One positive thing that's happening out of all the countries in Africa is that even though they've stopped the borders, they are allowing cargo to come through. So, trucks are able to come through. Shops generally do have commodities. Perhaps in South Africa, it seems to be where you've experienced more shortages in the supermarket, toilet paper and stuff like that. But in Africa, I certainly haven't picked that up. So we hope that the lockdown will be for a short period and allow economic activity. And even now, on a reduced basis, there is still some element of economic activity. In terms of agriculture, by its nature, if agriculture, I think they could carry on doing that. Their challenge is getting the crop to the market. So now it's a timing to say, are there any crops that are available for the market now, or can they still be tending their fields? And then perhaps when the crisis is over, their crop is also ready for harvest, a lot more attention than had the shutdown not been there.
Wonderful.
Joel, thank you for your question. I'm going to put you back on mute. And our next question comes from M. Griffin. I'm going to unmute you and go ahead with your question.
Thank you. Given that the U.S. is just having a monumental bill to help people who have lost their jobs or can't pay their rent, et cetera, has there been discussion within Opportunity in Chicago or within Africa about having clients not having to pay on the same schedule, that it could be delayed paying?
Tanae, you want to take that?
Tanae, you want to take that? Or I can as well add. Go ahead.
Okay. Certainly for the African countries that we are associated with, the central banks have been very understanding. They're also not going to be punitive on the financial institutions. They're allowing us to do restructures. In Uganda, they allow us up to 2 restructures. And they're also understanding that our results are going to be impacted. So from a regulatory perspective, there is a lot of support. So what our strategy is not to necessarily just offer it wholesale, but to take it case by case, because there are some who will be less impacted than others. But we certainly are not going to be on our clients. This is the time that we need to be understanding. And another thing that we have been discussing is a possibility of an interest reduction so that even after the crisis, their ability to recover is enhanced. Too, maybe you want to add?
Thanks, Tini. I think you covered the response at the field level. You know, we were, of course, working with the central banks in every country. What our approach would be, and to your question is, okay, you know, interest rate adjustments and principal repayment more restructurings are the 2 things we would have to consider at the country level. And every country is different, but I can tell you in every country that's the same conversation we are having. We will, as we go forward, I think that's the area where we, of course, would want to keep you updated. The financial impact is because these are, as we are seeing here in the US, these are completely unbudgeted, unplanned expenses. So, you know, and so how do we raise the resources necessary becomes a question. And that definitely will be coming back to this group and already speaking with several of our institutional donors and the union about that question as well. What you raised is the question of the hour, because you have for our clients, for Tine's clients in Uganda and Africa elsewhere, I think what is that there are 3 shocks, right? One, they are not prepared to deal with the illness if it comes, when it comes. 2 is livelihood. Most of these people are day laborers, day wage work, whatever they're doing, right? Daily cash. So livelihoods are impacted. 3 is the ability to bounce back. Resilience is extremely limited. So those 3 factors is what we as bankers to the poor are keeping in mind as we work with our clients. And I think as we contemplate our response across our network, that's what's going to drive us, is we want to make sure we are here today, but we also want to make sure that we are, our system will tell us, you know, through how resilient these families were. So what the most important thing for us right now is to stand with them and build the capacity to respond today and for tomorrow. My past experience now in 2+ decades of humanitarian development work, I can point to specific instances, none like this pandemic, which in specific countries resulted in increases in poverty. I expect increases in poverty, even if this is only for 3 weeks. For me, it would be inappropriate to say no. We will see. But our commitment to you and to we are going to stand with them through this process, and you're hearing that from.
Thank you.
Thank you, for your question. So I saw a few hands go up in the chat. I want to make sure I don't miss anybody. They went up and back down. So please raise your hand again right now so I can unmute you and can go ahead. All right, Peter Nelson, I see that you have a question. I'm going to unmute you. Go ahead.
Hello, Leanne. Hello, Atul.
Hey, Peter.
Hello, Peter.
Hey, here's a question for you that we're all struggling with in this incredible time right now. Our clients and the people we serve in the world are going to need more help than
Mhm.
ever. I just saw a stat the other day that 89% of the nonprofits in the United States have canceled events, fundraising programs, whatever. How can we help as ambassadors and donors? And do we have a strategy yet of how to raise funds in 2020 for Opportunity International?
Well, Peter, thank you for that question. I much appreciate. So yes, we are amongst those nonprofits. We've canceled all of our events, as you know. But I know Greg Roth is on the phone here with me on the video call, our head of development. Our philanthropy advisors have switched to virtual engagement, so you will be getting each of you, probably have already really at this time, rather than asking simply for more resources. First, we want to be here for you, because this affects all of us. It's probably the first time in the experience that there is a shared crisis, and it's a personal one, health one, and economic. Different degrees, but it impacts us all. So one, we want to be here with you and for you and walk with you together. Two is, as we are looking at the world, the first response, emergency response, we are setting up a rapid response fund, which we'll be more in touch later today, for both two things. One, immediate staff care, protective equipment, if there's immediate health care needed, to the question that was asked earlier. We can't have them go by public transport, so cost of private transportation when they go visit. And then client support, both, what do we do about loan repayments? I mean, this is completely unfunded. Our awareness exercises, community hygiene, group sizes. Actively, I would probably tell you, if you had trust groups of 12 people meeting, now you need to meet smaller groups. So there's an additional, not burden, but cost sharing there. So those are the kinds of things that we would use fund for, to answer, Peter, your question. Now, we will assess, depending on how long the crisis lasts, and frankly, the economic shock. My prayer is similar to Tine's, that short. We will assess what the impact is on our long-term fundraising. But right now, I think with the Rapid Response Fund, actively working with owners, so engage with Tine and his peers and see what's happening. I'm hopeful that our fundraising will continue. I have to tell you in closing, our donors, you all have been very faithful, even in the last 3 weeks. I shared yesterday with my board. I usually don't do this, but I felt unusual time I should. Day before yesterday, we had one of our highest growth from a number of, and each one of those people who sent in those resources wrote to me personally to say how they felt, including 3 institutions, CEOs of 3 corporations, that we needed the resources at this time to carry out our mission, so they were with us. So I just have to thank all of you. I could tear up, but from sincerely, with us, and we are stronger together. Thank you.
Thank you. All right, we have 2 last questions. I want to make sure we get to them before the end of our call. So Valeria, I'm going to unmute you and go ahead with your question.
Hello, everybody. My name is Valeria Pacheco, and I am based in Atlanta. I'm just a supporter of Opportunity. And more than a question, I just want some sort of positive note here. To say, several of the events have been canceled, including a lot of initiatives that we had here. But in response as well to all the other donors and supporters that have asked how to help, first and foremost, let's not lose faith. I know that God is going to help us to overcome this. And my biggest contribution would be just keeping the prayers, and the ongoing initiatives in our states or the cities where we support. So to cheer us up, I truly that again, the entire world overcomes this. And as far as my support from Atlanta, I'm definitely looking forward to continue working with the Chamber of Commerce and the different corporations here, just to at the appropriate time, bring back the events and help move, for example, the plant products in Nicaragua to the Atlanta area, and the businesses that we can connect them, as well as the coffee, farmers in Uganda. I had the chance, to meet Tine and see the wonderful world. So, and finally, hopefully, and I'm crossing the fingers for that, the biggest one is to have an Opportunity International kickoff event in Atlanta with the support again of the Chamber of Commerce, the Hispanic Chamber of Commerce, and UPS. So keep us in your prayers. Hopefully later in the year, where we overcome this, we will be able to move along. And thank you.
Thank you, Valeria. You gave a better answer to Peter than I did. So thank you.
Thank you so much, Valeria. All right, we have one last question. We'll make sure we get to it. Mike, I'm going to unmute you. Go ahead with your question.
I'll piggyback on Valeria's question just a little bit and get a little granular, but I know country is any more important than another, but since I've been to Nicaragua on an insight trip with some of my friends also on this call, can you tell us about the situation in Nicaragua in particular? And most particular, I'm wondering about the wonderful school that we started there, and whether that school had to shut down or whether they're still operational, or what's happening with that.
Yeah, Nicaragua, thankfully, so far is one of the least impacted countries. I think it was only yesterday they actually had their first test. So far operations impact has been very limited in Nicaragua, but we are now gearing up for more scale, similar to other places. So it's for the most part the Central American countries have so far been sheltered, but I expect that very rapidly. Valeria, have you heard about the school from directly? I know you stay in touch with them. Valeria.
Well, you know me well. And by the way, I'm originally from Nicaragua, so thank you so much to everyone who has supported my country. Yes, I'm in very close touch with Oscar always. And I do know that, and I'm pretty sure that he's connected because I shared the link with him. As far as I know, the school, I believe, has gone to an online platform. I guess, thank God, at least in the context that resource, for the children. But I would definitely, and I keep telling my people and my friends in Nicaragua, unfortunately, and I have to be honest with that, not being political, but I am in healthcare, and I know what can happen if we do not take care of the recommendations from the medical authorities, right? And Nicaragua is not in any position to actually have an outbreak of this sort. So I'm definitely proud of the initiative that our opportunities doing in Nicaragua to protect the children, even though the government is not really promoting the seriousness that this deserves. So I'm very proud, as always, of the leadership in OI Nicaragua. But as far as I know, they're doing whatever they can to, to face this in the event that it becomes worse down there.
Thank you.
Thank you.
Thank you. Thank you very much. All right, everyone, before we wrap up, I just want to say a few words. Thank you, supporters, governors, ambassadors, for your continued support, for your continued prayers. We need them both. Our leadership needs them, and we can do this work without you. We will do all we can to stay in touch with you. If you need us, please reach out. We are here. And I would like to leave you with something that I said to all of our employees in the letter that I sent them about a week ago. And I asked them not to fear the stillness of your homes and do not fear the stillness of your neighborhoods. And to use this time, meditation, prayer, reflection. I have done the same. And I know that when this crisis is over, and we will get through this crisis, there is no doubt about that. But when we get through, ask yourself, do we really want to go back to normal? I would argue that we don't want to go back to normal. And this is how I see God breaking into this crisis. We have gotten into this world, and this work is just 110% of our lives. And I see this as God's work saying it's time to slow down. It is time for all of us to put our sights back where they need to go, and that is on our God and faith in our God. And it's also time for act with those that we always say we don't have time to get with. So use FaceTime, use WhatsApp, and spend more time at the dinner table. And when this is over, know that I, at least personally for us and for others, we are going to make some changes. This is one of the ways that I see that God is breaking in to calm the chaos. And that is God needs our attention. And I think it's time to give God our attention. We are all so grateful for all of you, for all the employees of Opportunity International. We will be talking with you again. And we thank you for your time. We thank you for your leadership, your prayers, and your support. So with that, good night, good afternoon. Thank you.
Thank you, Leanne.
Bye, Atul. Bye, Tanae.
Bye, Leanne. Bye,
Bye,
everyone.
More later.
Right.
Thank
Bye,
you.
everybody.
Bye-bye. Bye for now.
Thank you.